Tashrab embryology of the thyroid gland. The thyroid gland is the first endocrine organ to develop in the embryo. Its development involves the following stages. 1. Formation. The thyroid gland originates as an endodermal thickening in the floor of the primitive pharynx at around the fourth week of gestation. This thickening gives rise to the thyroid primordium, a midline structure located between the first and second pharyngeal pouches. 2. Migration. The thyroid primordium grows and descends in the midline of the neck, passing anterior to the developing hyoid bone and laryngeal cartilages. As it migrates, it remains connected to the tongue via the thyroglossal duct, which typically obliterates later. 3. Differentiation. By the seventh week, the thyroid reaches its final position in the neck, anterior to the trachea and inferior to the thyroid cartilage. The primordium differentiates into two lobes connected by an isthmus. Follicular cells arise from the endoderm, while parafollicular cells, C cells, develop from the neural crest cells of the fourth pharyngeal pouch. 4. Functional maturation. By the 10th week, the thyroid begins to secrete thyroid hormones, T3 and T4, which are critical for fetal development, particularly brain development. Anatomy of the thyroid gland. 1. Location. The thyroid gland is located in the anterior neck, spanning the C5 to T1 vertebrae. It lies anterior to the trachea and isthmus, with the lobes extending on either side of the trachea. 2. Structure. Lobes. Two lateral lobes and a central isthmus connect them. A pyramidal lobe, remnant of the thyroglossal duct, may be present in about 50% of individuals. Size. Each lobe measures approximately 4 to 6 centimeters in length, 2 centimeters in width, and 1 to 2 centimeters in thickness. Capsule. The gland is enclosed by a thin fibrous capsule and surrounded by pretracheal fascia. 3. Blood supply. Arteries. Superior thyroid artery, branch of the external carotid artery. Inferior thyroid artery, branch of the thyrocervical trunk. Veins. Superior and middle thyroid veins drain into the internal jugular vein. Inferior thyroid vein drains into the brachiocephalic vein. 4. Lymphatic drainage. Lymph from the thyroid drains into the prelaryngeal, pretracheal, and paratracheal lymph nodes. 5. Innervation, sympathetic, cervical sympathetic ganglia, parasympathetic, branches of the vagus nerve. 6. Histology. The thyroid gland consists of spherical follicles lined by a single layer of cuboidal epithelial cells. Inside the follicles is a proteinaceous substance called colloid, which contains thyroglobulin. Parafollicular C cells are located between the follicles and secrete calcitonin. Physiology of the thyroid gland. 1. Hormone synthesis, thyroxine, T4, and triiodothyron, T3, are synthesized in the follicular cells. Steps of hormone synthesis, iodide uptake, active transport of iodide into follicular cells via the sodium iodide symporter, NIS. Iodination, oxidation of iodide to iodine by thyroid peroxidase, TPO, and incorporation into tyrosine residues of thyroglobulin to form monoiodotyrosine, MIT, and diiodotyrosine, DIT. Coupling, MIT and DIT combine to form T3, and two DIT molecules combine to form T4. Storage, hormones are stored in the colloid until released. 2. Hormone release. Upon stimulation by thyroid-stimulating hormone, TSH, thyroglobulin is endocytosed, cleaved by lysosomes, and T3 and T4 are released into the bloodstream. 3. Hormone regulation, controlled by the hypothalamic pituitary thyroid axis. Hypothalamus secretes thyrotropin-releasing hormone, TRH. Pituitary releases TSH, stimulating thyroid hormone production and secretion. Negative feedback, T3 and T4 inhibit TRH and TSH secretion. 4. Functions of thyroid hormones. Metabolism, increase basal metabolic rate, BMR, by enhancing oxygen consumption and energy production. Growth and development, essential for normal growth, skeletal development, and brain maturation in children. Thermogenesis, regulate heat production by stimulating mitochondrial activity. Cardiovascular effects, increase heart rate, cardiac output, and myocardial contractility. Neurological effects, influence mood, cognition, and reflexes. 5. Calcitonin secretion, produced by parafollicular C cells. Calcitonin reduces blood calcium levels by inhibiting osteoclast activity and promoting calcium deposition in bones. Clinical relevance. Disorders, hypothyroidism, e.g. Hashimoto's thyroiditis, hyperthyroidism, e.g. Graves' disease, thyroid nodules, and cancer. Tests, Thyroid function tests include serum TSH, T3, T4, and thyroid antibodies. Imaging, ultrasound, and radioactive iodine uptake scans are used for diagnosis and management. This detailed overview captures the essential aspects of the thyroid gland's embryology, anatomy, and physiology.